humbled to be standing here today on this very important occasion. It has been said, I think, but I will just briefly repeat that ECSACONM is a 16-member state college for nurses and midwives, which was established in 1988 by the Health Ministers' Conference resolution. And it was officially inaugurated in 1990 in Malawi by His Excellency the late President Dr. Kamuzu. The present goal is to improve the quality of health of communities through programs that strengthen nursing and midwifery education, practice, research, and leadership and management. Your Excellency, ECSACONM Scientific Conference is a biennial event which is held on a rotational basis among the member states. And I'm happy to inform you this afternoon that this is the second time we are in Eswatini holding this conference. The first one was in 1998, and it was officiated by His Majesty the King Mswati III. What is unique about this one, Your Excellency, is that it is combined with our quadrennial congress, where the college will be electing new leadership. And I want to inform you, Your Excellency, that I'm now down with 4 days to hand over the baton to the coming president and next ECSACONM leadership. This conference should have been held in 2020 from our 2018 conference. But unfortunately, due to the unseen circumstances, COVID-19 pandemic came and it made it impossible to have our conference in 2020. However, having watched consciously how events evolved according to the disease, we eventually had our conference in 2021 in Arusha, Tanzania. Your Excellency, ECSACONM continues improving the quality of health of the communities through strengthening the contribution of nurses and midwives. ECSACONM has led several important regional initiatives to build capacity in nursing education, nursing regulation and practice over the last 3 decades. As I've said, it was formed in 1990. It means this is our 32nd year. Your Excellency, allow me to state that the contribution of nurses and midwives in the health system in any country cannot be overemphasized. It is worth noting that recently the 3 studies that were released, which I'm proudly here stating that ECSACONM was a contributor to those studies, which I will namely say the State of the World Nursing Report and the State of the World Midwifery Report, as well as a report that we did in collaboration with our partners as ECSACONM, which we call the ECSA Health, Nursing and Midwifery, Education and Labor Markets Study. These 3 reports, Your Excellency, they had a lot in common, probably because the information was coming from us, and these findings of these reports pointed out that there is a critical shortage of skilled nurses and midwives in the world, but more pronounced in sub-Saharan region where we belong. Furthermore, other studies, Your Excellencies, have shown that more than 80% of the population in low-income countries cannot access health services because of lack of sufficiently trained health workers. Most countries face absolute or relative shortage of nurses and midwives, sometimes both. Those shortages are critical challenges to achieve the universal health coverage, as well as the SDGs, and they need to be addressed by investing in nursing and midwifery. It is on this ground, Your Excellency, that ECSACONM has found the opportune time to start specialized training for nurses and midwives, to close these gaps of skills shortages and also to reduce shortages of the nursing and midwifery workforce. We are planning to start collegiate trainings which will allow the nurses and midwives to be attending school at the same time continuing with their work. We believe that with this kind of training, Your Excellency, we will also reduce the shortages that comes as a result of the nurses and midwives going to classrooms for 3 years or 2 years, but this one they will attend the studies online with a 1-year practicum, and that will reduce the time that they will be out of the workplaces. Your Excellency, nurses and midwives make an essential contribution to all components of primary health care and are frequently the highest level providers of primary health care, which has a critical role in health service delivery to achieve universal health coverage and sustainable development goals. It is proven without doubt, Your Excellency, that a strong nursing and midwifery workforce increase patient safety, improve health outcomes, and increase access to health services. The COVID-19 pandemic has profoundly affected the nursing and midwifery workforce across the globe. And as frontline workers, the nurses and midwives were and are still under immense stress with high risk of exposure, long working hours, inadequate protective equipment, psychological stress, and sometimes stigma. This, Your Excellency, has exposed gaps and vulnerabilities in our health systems, and also provided important lessons for future preparedness and responses. As I conclude, Your Excellency, I'm humbly requesting for support from governments, policymakers, regulatory bodies, and other private partners to support nurses and midwives by investing in the training programs that ECSACONM is planning to start in January 2023. As I plead for this support for ECSACONM, I do not want to forget our sister colleges, because our specialist doctors, we also need them. We can't work without them. And at ECSA Health Community, we have a body where all the colleges work together, and we always want to see each other growing in that regard. I want to salute you, nurses and midwives, especially those who sponsor themselves, all the way from wherever you are from. This shows commitment to the nursing and midwifery fraternity and commitment to the college. I cannot forget also to thank the governments of the various countries that are here, and also organizations and private sponsors who also sponsored necessary midwives to attend this very important event. I also want to thank those individuals who are not necessary midwives, who are with us here today to celebrate with us. So thank you very much, and I hope we'll have a wonderful day.